Hello, we're here with Sara. Hi, Sara.
Hi.
How are you?
I'm doing well. How are you?
I'm fantastic.
Awesome.
So Sara came to me about 3 months ago or so, or a little less probably, and she presented with bunions on both feet, as well as flat feet with hyperpronation, and what we diagnosed ultimately as an unstable talus. And I explained to you that your bone below your ankle was dropping down and basically creating your flat feet, right?
Yes.
And you've known you had flat feet all your life, right?
Yeah.
Yeah.
Pretty much.
And was that creating problems for you? Were you having issues with any knee pain, back pain, or muscular pain, or unable to do any activities you normally would have done?
I had slight back pain actually, and I never really accounted it to my feet. So yeah.
Have you had any back pain recently?
No.
Okay. So we did something a little unorthodox, which normally we don't do, which is we did bilateral bunion surgery, where we broke essentially both bones in her feet and put hardware in there to hold it back in place, and we'll show you those x-rays at the end of the video. And then we also put the HyProCure implant into both feet to restore the alignment of her feet and get her an arch again. And we're now 6 weeks out, as I said. And Sara, why don't you just tell us a little bit about your experience about dealing with what we told you beforehand and how it's been up to this point.
Well, when I got the surgery, initially I was a little hesitant to actually fix the flat footness in my feet. But I went ahead and did it anyways, and I'm really satisfied with what happened. From the first time I stood up, I noticed it different instantaneously, and I was just amazed. And then also with the bunion correction, it's just been amazing, the whole transformation, and it's been almost painless. I mean, obviously there's discomfort, but pain-wise, it's not there.
So you would say that, people who say bunion surgery is a very painful experience, and it's, you got to take a lot of drugs. Your experience was not that.
Yeah, I'm not a person who likes to take drugs if I don't have to, and I almost have never had to. Yeah, it's been great.
Okay, that's awesome. So let's have you stand up for a second, and we'll take a look at these awesome feet. And what we can see is that we have corrections, and again, we'll show you the x-rays before and after, but you can see now there's a nice arch there on both feet, and hopefully in another couple of weeks or so, or about maybe another month, you'll be running, jogging, hiking, whatever you want to do.
Good to me.
Okay? Okay, here we're looking at a preoperative x-ray of her foot prior to surgery, and we can see that the bunion deformity is present here, and then what's hard to see here is that the talar angle is pointing out this way relative to the second metatarsal. But that's what we're looking at preoperatively. And then on her lateral view, we see that the talus is closed down and there's no opening here, and the arch is somewhat depressed. Now we're looking at the post-op view, and we see the correction of the bunion through here. Everything's straight, and we had to make osteotomies of the first metatarsal, as well as the proximal phalanx here, where we did an Aiken osteotomy. And right here, the implant is still in place, and the alignment is much better now with the foot. And if we look at the lateral view of the same foot, we now see a much more impressive looking arch with the HyProCure implant here, and the osteotomy here, and the angle is improved here. So we have a much better result, and as you saw from the patient, her arches are now prominent, and she has the ability to walk much better at this point, so early out.